Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and today I'm going to show you a different application of Botox. We use Botox most commonly in the face, as most of you are familiar, to help reduce lines between the brows, on the forehead, around the crow's feet. I use it a lot in the marionette lines, and then we can also get a really beautiful neck lift with Botox. And then other applications are we use it for migraine headaches. We also use it for excessive sweating from the underarms, where it stops you from sweating, which is really awesome. We can use it even in the hands and the soles of the feet, groin area, anywhere on the body. Now, since Botox essentially atrophies muscle, we can use it also in the calf muscle in patients who have a thickened gastrocnemius muscle, which can be a problem just aesthetically. Sometimes patients don't like it because they may not fit into their boots correctly, and they just want a slimmer appearance of their lower legs. So that's one beautiful way to actually atrophy that gastrocnemius muscle and have a more slimmer contour of the legs. Now, some patients actually like a hypertrophied gastrocnemius muscle, in which case then we recommend they do M-Sculpt, which can actually help to build muscle and hypertrophy the calf muscle. But in this case, we want to atrophy the muscle. We want to achieve a slimmer appearance to the calf area. Now, if somebody has fat in this area, then I will use vaser liposuction to get that fat out. And there's a few other non-invasive treatments we can do in that regard as well. But today we're going to inject about 50 units of Botox into each of the calf muscles here. And they're just little injections going directly into the calf muscle. I've kind of drawn out the area I want to treat where the hypertrophy is occurring when the patient was standing and I had her legs flexed so you could really feel the muscle. And so just going directly into the muscle and putting little depots of the Botox. And she's flinching just a little because the needle is a bit sharp, but overall not too bad, is it?
No. It's a stain.
Just a little tiny sting, yeah. Botox comes as a powder in the vials, and it has to be constituted with saline. So we can constitute it with really any amount of saline that we want. If we want a more concentrated Botox solution, then we'll put less saline and get a higher concentration of units per ml. And in this case, because it's such a large muscle and we want to spread it all around the muscle, the 50 units, I've diluted a little bit more so that we can get it into the entire span of her gastrocnemius muscle here. The Botox usually lasts about 3 to 4 months. The last time the patient had this procedure, she felt like it lasted her about 8 to 10 months. And that is probably because she may have started having some function back somewhere between 3 to 5 months. And by 8 months, probably her muscle had hypertrophied back to where she had begun. Okay. Leg one is completed, and we will. Are you okay?
Yep, the left
Okay.
one's done.
Yeah.
Let me know you start.
Mm-hmm. Okay, here we go. And atrophying of the muscles is exactly how Botox also works, to help get rid of your Levin lines between your brows and your forehead. It stops that muscle from being able to contract, and the muscle gets weaker over time. It also trains you not to make certain movements, which can have a nice long-term improvement as well. Okay, that's it. We are done.
Okay.
And this will start working in just a few days, about 2 to 3 days. It can take 7 to 14 days for the Botox to fully set into the muscle. It should not cause any dismobility or change in the way you walk or your gait, but it should slim that calf muscle, and we'll be looking forward to seeing you. Okay?